Welcome to Podcast for Patients. My name is Lee Clark, Director of Patient Services, and I will be moderating the podcast today. Before we get started, I'd like to thank our corporate sponsors and our diamond sponsors, Novartis and Alexion, and the patients and families who support our organization. Without your support, our podcast would not be available. So today I have the pleasure of speaking with Dr. Satheesh Chonat, who is with Atlanta Children's in Atlanta, Georgia, and we're going to be talking about the recent approval of PiaSky for pediatric patients. Welcome. Thank you so much for joining me today.
Thank you so much for having me. It's an absolute pleasure.
So what is PiaSky?
Yeah, so PiaSky is the brand name or commercial name for a drug called crovalimab. Crovalimab is a new in-class anti-complement C5 antibody. So it's a novel antibody that just recently got approved by FDA for patients with PNH. It's currently approved for adults and children over 13 years of age, weighing over 40 kilograms of body weight.
How is it given, and what do we know about side effects?
Yeah. So crovalimab as a medication is highly soluble, so that has helped for it to be allowed for a low volume subcutaneous injection. So injection that's given typically just under the skin. And it's given every 4 weeks as a maintenance dosing. So children and adults have to get a few weeks of loading doses. The very first is given intravenously, and subsequent ones are given subcutaneously. Because it can be given or administered subcutaneously, it can be self-administered at home. Answering your second part of the question, what are the known side effects? PiaSky has been studied across 3 phase 3 clinical trials in patients with PNH. So the pooled safety data, putting them all together, the overall safety profile of crovalimab or PiaSky has been shown to be similar to eculizumab, which is the other medication commonly used for PNH. And the rates of adverse events are comparable between the populations. But it's important to recognize that all complement inhibitors carry a class risk of infections, meaning especially the infections with encapsulated bacteria. The ones that we talk about most are a risk with meningococcal infections due to how the complement blocks the body's ability to fight such infections. There were no occurrences of meningococcal infections reported in any of these studies. Other common adverse events that occurred in a small proportion of patients receiving crovalimab included pneumonia, respiratory tract infections, viral infections such as COVID-19, low platelet count, and other infusion-related reactions, so reactions secondary to the medicine given subcutaneously. Another unique side effect that's important to remember for patients and providers that were noted in the clinical trials were these transient immune complex reactions. So these are hypersensitivity reactions, and they were only seen in those patients who switched between crovalimab and other C5 inhibitors, such as the eculizumab or ravulizumab. So prescribers need to be aware of this reaction and be cautious when a patient switched either to crovalimab or crovalimab to another C5 inhibitor.
Thank you. Can you tell us about the clinical trial that led to the approval?
Yeah, excellent question. So crovalimab, as mentioned earlier, was studied across 3 phase 3 clinical trials in patients with PNH. So they pooled all the data from about 377 patients with PNH treated with crovalimab across these 3 clinical trials. And that's what led to this FDA approval. So the 3 studies were called Commodore 1, 2, and 3. In Commodore 1, they selected patients who had previously been receiving C5 inhibitors, such as eculizumab, and they randomized those patients to receive either crovalimab or continue on their C5 inhibitor eculizumab. And there were about 45 patients who received crovalimab in this study. In Commodore 2, which is one of the primary study which led to the FDA approval, they selected patients who had never been treated with C5 inhibitor, so they called as C5 inhibitor naive patients. They were randomized to receive crovalimab or eculizumab, a ratio of 2 to 1. And they offered those patients who were not initially randomized to receive crovalimab, they could switch to crovalimab after the initial 25 weeks of treatment. The Commodore 3 is another study which was a non-randomized study, meaning the patients where they knew what drug they were getting, and they were for all patients who had never been treated with C5 inhibitor, and they received crovalimab only. So in combination, these three clinical trials helped its approval because these studies helped to demonstrate the efficacy of crovalimab in blocking the complement-mediated hemolysis or the breakdown of red blood cells. And it was shown to be non-inferior to eculizumab.
What is the difference between PiaSky and Ultramarys?
Yeah, another excellent question. So both are complement C5 inhibitors, but they actually act on different spots on the C5 molecule. It's important to note there are no head-to-head clinical studies comparing PiaSky and Ultramarys. Both of these are FDA approved for children. Crovalimab is approved for those over 13 years of age and weighing 40 kilograms or more. Ultramarys is approved for all ages and children 1 month and older. But the PiaSky is given every 4 weeks once they are on maintenance dosing, while the Ultramarys is given every 8 weeks, unless the child is under 20 kilograms, which requires Ultramarys to be given every 4 weeks. So as I mentioned earlier, PiaSky is given just under the skin, so that's an important difference. So it's given what's called administered as a subcutaneous injection. So that certainly has a risk of lead to some injection or infusion-related side effects. Ultramarys requires IV line to be paced because it's always given intravenously. But both can be administered at home depending upon what's available based on your insurance, etc. It's important to monitor patients switching from C5 inhibitor to PiaSky or from PiaSky to another, as they are at risk for type 3 hypersensitivity reactions, especially the first few weeks after starting this medication. These are the major differences between PiaSky and Ultramarys.
What else is important for parents to know?
Yeah, excellent. So in addition to understanding that these are PiaSky and Ultramarys or other eculizumab are commonly used medications for pediatric patients with PNH, it's important to remember that PiaSky is a new drug, but it's definitely studied and is shown to be non-inferior to eculizumab in several studies, as mentioned earlier. The efficacy of crovalimab or PiaSky and the side effects of PiaSky are comparable to eculizumab. I'm mentioning eculizumab, even though it's not officially approved for children with PNH. That's because there are no head-to-head studies comparing PiaSky to Ultramarys, which is the only other approved medication for children with PNH. So if there are families out there who are interested in learning more about PiaSky, please reach out to your provider treating PNH, especially if you're 13 and older, or you could reach out to one of the AAMDS recognized centers treating children with PNH, and we can happy to discuss the eligibility criteria, etc.
Well, thank you so much for sharing your time and your expertise with all of us and learning about the new treatment option available to parents and to physicians. This is an exciting time for families with their loved ones who have been impacted by PNH. If you'd like to learn more about the new treatments, please do visit our website, which is aamds.org, or give us a call at 800-747-2820. Thank you again so much for joining us today. We really appreciate you sharing your time.
Thank you.